Hello, my name is Kristin Amato. Today I will be doing my second narrated presentation for psychology. First, I'll explain the differences between hallucinogens and cannabis. Secondly, I'll discuss why there's a separate listing for cannabis substances in the DSM-5. Lastly, I'll describe the dangers associated with marijuana use. To start off, I will define what hallucinogens are. Hallucinogens tend to interfere with the brain and the central nervous system, and in this way, the results end up in radical distortions of the person who's using this type of drug. It changes their perception of reality. It tends to lead to different images, sounds, and sensations, and these sounds and sensations and these images don't actually exist. They are actually all just vivid hallucinations, and by that they have major side effects for the person using them. Some side effects do include high blood pressure, agitation, panic attacks, dizziness, can tend to flashbacks after using this. It does increase body temperature, which may lead to chills for different types of people, and many other unwanted side effects that can be used because of hallucinogens. Now, different types of hallucinogens do include LSD, which is known as acid for most people. It's named according to how that certain drug is designed. I have heard of examples. A picture of a yellow star would attract the name yellow stars instead of just outright naming it LSD. Another street name or example of a hallucinogen is mushrooms. It has been known to be called magic mushrooms, shrooms, Liberty caps, and there are a few more associated nicknames. There is PCP, which is also known as angel dust or peace pill. And the last one I will discuss is ketamine, which is known as Special K, Simply K, Kit Kat, or Super K. In the next slide, I will discuss what is cannabis. Cannabis is actually known as marijuana. It is a type of depressant. Depressants tend to slow down the activity of the brain and the nervous system. When you slow down both of these systems, it tends to also slow down the communication between the two. For some medical purposes, they can relax muscles, calm the nerves, and there have been reports of depressants being useful for sleeping disorders such as insomnia. Now, some side effects that some people may not be so happy with or may have end up being unwanted. It does include to have confusion. It does have anxiety that comes with cannabis, and there is a sense of confusion, and you do get restless, and you tend to have a lower blood pressure, and your heart rate can increase, which are all side effects that most people do not desire when hoping to relax the nerves and calm down and hope to unwind because of cannabis. Even though this drug is known to, like I said, calm the nerves, it does have these unwanted side effects that most people do not know about until it tends to act on their body when they do take this type of drug. Now, in the next slide, I'll compare and contrast hallucinogens and cannabis. Now, hallucinogens, like I said before, for a definition, they do tend to interfere with the brain and the nervous system instead of cannabis, which is known as a depressant that tends to slow down the brain and the nervous system instead of interfering, which is a little bit different. Now, hallucinogens and depressants happen to be two main categories in categorizing drugs. It just so happens that cannabis is not labeled as a hallucinogen. This is because it doesn't have the side effects that hallucinogens tend to have, as I mentioned before. The unwanted side effects such as panic attacks, bad hallucinations, increased body temperature, impaired coordination, I apologize. Now, these side effects can arise while taking cannabis if taken in large amounts. Now, in this type of situation, most would consider cannabis to be a hallucination, not on paper, not in facts, just based off experience. Because the larger amount that you take, the worse the unwanted side effects will be. Now, it just so happens that bad trips, quote unquote, bad trips are associated with hallucinogens. Cannabis can have those bad trips as well, but most people do not take cannabis in large amounts to make it so unwanted and so undesirable as a hallucinogen. Now, for hallucinogens, the effects generally wear off when the drug wears off. It can sometimes continue for some time afterwards, after taking a hallucinogen, but the cannabis that you consume, it tends to go away easier, and it has less effect on a person's body compared to a hallucinogen. Now, in the next slide, I'll discuss the DSM-5 and the cannabis and the reasons why it's its own section. Now, in the DSM-5, there happens to be a section for cannabis abuse and dependence, which is known as cannabis intoxication, cannabis use disorder, cannabis withdrawal, and overall it's just its own addiction. So the reason why it's not named cannabis in related substance use disorders is because it's simply its own disorder. It tends to have many symptoms that other disorders have, except it's so in-depth and there's so much information that is included in these types of disorders and this type of drug that it needs to be defined by itself in the DSM-5. Now, cannabis intoxication, it's defined pretty much as recent use of cannabis. So if a person tends to use it recently and they get caught, you can be labeled as intoxicated by cannabis. Now, if there are some signs of dry mouth, increased appetite, developing within 2 hours of cannabis use, you can be labeled as cannabis intoxicated. Now, those are just a few examples of that type of cannabis disorder. Now, cannabis use disorder, it's technically a problematic pattern of cannabis. It's clinically proven to be an impairment and a distress on the body. And within a 12-month period, it's often taken in larger amounts or over a longer period of time than it was intended to be. Now, there are people that crave or tend to have a strong desire to use cannabis. And just one more example of cannabis use disorder. There can be recurrent cannabis use in situations in which it's physically hazardous. For example, if you go to work and you tend to have that confusion and anxiety and all these different symptoms that affect your workplace, you can be labeled with cannabis use disorder. Now, last but not least, cannabis withdrawal. It technically includes usually daily or almost daily use over a period of the last few months of cannabis. Normally, some signs and symptoms that develop within a week or so are nervousness, sleep difficulty, depressed mood, aggression. These symptoms can all be included with cannabis withdrawal. Now, it's just like any other drug. People do get addicted to it, but they just have a certain name for when you don't have it for a certain period of time, which is cannabis withdrawal. Now, last but not least, I will discuss the dangers of marijuana that most people do not know about. Yes, there are no reports of anybody overdosing or dying from marijuana, but there are many unwanted side effects. Now, marijuana actually, as I said before, increased heart rate, confusion, redden in the eyes, low blood pressure. All these unwanted side effects are very short term. But what actually goes on in the brain as marijuana is smoked, is consumed, there is a compound that is actually in marijuana or cannabis, and it's called, excuse my pronunciation, tetrahydrocannabinol, which it basically acts on specific brain cell receptors, and it plays a role in normal brain development and function. Now, this being said, it overacts parts of the brain that contain the most number of these receptors, which causes that high feeling for different people. It includes impaired body movement, impaired memory, altered senses, and all of these are short term, and it can affect people right on the spot as soon as it's consumed. Now, some long-term effects, as I said before, it does affect the brain development. Most marijuana users begin at a young age, which can reduce thinking and learning functions, different memories, whether short or long term, and it does affect the brain and how it builds connections over a period of time. Now, these effects that I'm discussing, they can be long-term, which means for a long period of time, or they can remain permanent, which is unfortunate. Most people don't realize the severity of marijuana and the fact that it's not something that should be taken lightly, even though there are no reports of deaths. Now, different physical effects that could be long-term, could be short-term. There are breathing problems as soon as you consume marijuana, even if you don't feel it at first. It can affect lungs, it can affect your heart, it can affect different heart rates dealing with the heart, and especially women that are pregnant, it can develop multiple behavioral problems and brain problems in babies, which you may not even aim to do, but it can happen. There are also short hallucinations, which are called temporary hallucinations, sensations or images that seem real but they aren't, which relates to hallucination. I apologize. Hallucinogens. Thank you. That don't last too long, but they are there, which is another thing that people don't realize is a huge danger of marijuana, and most people will not want to experience. Now, throughout my presentation, I have gone over many different things. I have explained the differences between hallucinogens and cannabis. I have discussed why there is a separate listing of cannabis substances in the DSM-5, and I have described some dangers associated with marijuana use. I hope you enjoyed my presentation, and thank you very much.